Good morning, Ginette. Thank you very much for taking the time to speak to us on medicine in a nutshell. Now, you're a senior ODP, which is an operating department practitioner. Is that correct?
Yes, it is.
Brilliant. Thank you. So, can you tell us, for those who don't actually know, what's the actual remit of an ODP? What does an ODP do, please?
An ODP is based in theatres. They work predominantly in theatre, and they can work in any area within the theatre complex. The main role of an ODP is anaesthetics. We are there to assist the anaesthetist in all of the anaesthetics that are available, including regional, general, local anaesthetics, and we are responsible for checking anaesthetic machines in the morning, making sure that the cupboards are stocked with the right drugs that we need for the day, setting up fluids, and to support the patient throughout their journey from an anaesthetic point of view. Also, from an ODP role, we scrub and pass the instruments to the surgeons as well, responsible for the swab counts, the instrument checks, and all of the process for the operation. And we also work in recovery as well. Our skills extend to the recovery area, where we are trained as part of the training, the 3-year process, to work in recovery and look after the patients post-operatively as well.
So that's a pretty broad remit.
Yeah. It's a very full job. You can sort of make it narrower to, your specialist field of interest if you want to just do anaesthetics. We also cover maternity and delivery suite as well, for any anaesthetic interventions that they might need, from epidurals, spinals, any ladies that need cesarean sections and need pain relief. As part of our duties as well.
Oh, right, okay. And this, to become an ODP, it's a university course. You alluded to a 3-year course, is that correct?
It is, yeah. The universities run a 3-year course for the ODPs. That's a mixture of in-university training and also on-the-job training, where you put in placements. They have 3 1-year placements, where you'll spend the year within one area of the hospital. You go to different hospitals for each of your 3 placements, and you'll learn both anaesthetics, scrub and recovery within that training process. So
it sounds like a very practical, hands-on sort of job, isn't it?
It is, yeah. Predominantly it's a very sort of hands-on, very patient-focused, very patient-orientated job. Which is why I love it so much and why I got into it in the first place. And yeah, you get a sense of achievement every day you come to work.
And also sounds like quite a busy job then.
Very busy, very busy. Depending on the unit that you work in,
yeah.
And the amount of patients that you get through in a day, you can have one patient that's on the table all day and you're just doing the one case. But with that one case, they need a lot of work. You might be getting blood out of the fridge, you're doing regular blood tests on the patient, supporting the anaesthetist within that process, or you could be scrubbed for the whole day. And
once you're a senior ODP, and once you've become an ODP to go on going up to becoming a senior, there's a lot of professional development along the way, presumably.
Yes, there is. The expectation as you get through your career is that you're supporting the junior staff, supporting the new starters, being preceptors and mentors for the students and the new starters that we have within the hospital and within the trust, and just sort of being a point of contact from the knowledge that you've gained to be able to share that information with other staff.
Now, all jobs have ups and downs. Okay, and you've already said that you love what you do, and one of the things is because the busyness of it and the variety. So what are the ups and downs, being an ODP for someone who may be considering it as a career?
Yeah, so the ups are, you get to look after patients every single day. You know, somebody's mum, somebody's dad, brother or sister, and you can give them a quality experience. You know, it's not a pleasant process of coming through theatre. There's something wrong that needs to be fixed, which is why you're in theatre in the first place. And if you can make that journey just a little bit less traumatic for them, giving them that reassurance and that care and attention while they're in the trust of you, then you know you've done a good day's work.
What are the downsides?
The downsides, honestly, the shift patterns, you know, but the operating theatres run 24 hours a day. You know, they don't stop. We always have a service for any patient that needs an operation day or night. So realistically, if you become an ODP, the shift patterns, night shifts and on-calls, you have to take into account, really. Now, you get so much experience, even though it is a downside, you get so much more experience working a night shift than you would during a day. It's the sickest patients that come through the doors at 3 o'clock in the morning, and it's that experience you can't read, you can't learn in a university. It's hands-on, day-to-day, saving someone's life.
Now, a bit like me being a plastic surgeon with a trauma interest, you enjoy the adrenaline, don't you?
Absolutely.
In the middle of the night,
yeah,
yes.
That's what we come to work for, because, you know, like I say, they are the sickest patients, and those are the patients that you know you've done your best for them. Sometimes it doesn't end well, you know, but that is what we do, and day in, day out. And if we can make that journey a little bit better for the time that they're there, then you've done a good day's work.
Well, thank you very much. It sounds like the job of an ODP and being an ODP is an exciting and very broad field with lots of positives about it, and that's really a lovely insight into it. And hopefully somebody looking at this video may think, maybe I'll be an ODP, because a lot of people don't know what an ODP is. Yeah. Is there a shortage of ODPs in the country?
Absolutely.
Do we need more of you?
Absolutely. And I've been doing the job 25 years, and I don't know to this day what I would do if I wasn't doing this job.
Excellent. Thank you so much.
Thank you.
And it's been a pleasure interviewing you today.
Thank you.